Hello all, I am Dr. Manoj Ayyappath. I am a cancer surgeon from India. Welcome to my channel. Today I am going to talk to you about the management of rectal cancer. So cancer which comes in the rectum. So what are the symptoms? What are the problems associated with that? What are the treatment options and how do you investigate treatment options and other things? I'll give you in a short period. So first, let us see what is a rectal cancer. Rectal cancer is a growth in the rectum. Rectum is the place where the fecal matter is stored in human body. That is approximately 15 centimeter from the anal hole, that is anal verge, around 15 centimeter. It is divided into three parts: upper, middle and lower. So there is a disparity in different thought process. Certain people say it is 12 centimeter from the anal hole. Certain people say it's 15 centimeter from the anal hole. So basically it's around 12 to 15 centimeter from the anal hole. You call it as rectal cancer. So how do the patient present with? Generally, a patient with rectal cancer, they are old patients, more than 60 years of age. They start passing blood in the stools. It may be fresh blood, or generally it is color is towards the maroonish side. And also the patient starts passing mucus with stools. So blood in mucus and blood through stools, there are very important symptoms. They'll have diarrhea. So early morning they start passing loose stools. They have, sometimes certain patients have constipation, difficulty in passing stools. So sometimes they have heaviness and pain, maybe a symptom. And very rarely when they spread to other organs, they have weight loss and loss of appetite. Patient doesn't feel like eating. These are a few symptoms of rectal cancer. So if the patient feels, someone feels like, okay, I have this rectal cancer, what should be done? You immediately go and visit a surgeon. So he will examine you. He will put his finger into your anal hole, and many a times you can diagnose a rectal cancer, because around 7 to 8 centimeters of the anal hole is reachable by your finger. You can diagnose by a per-rectal examination, and you can do a proctoscopy. This is passing a small tube inside the rectum and see whether there is a growth or not, and take biopsy. So that is an office care procedure. You come in the office and do it and go home. And if it is not reachable by finger, the next investigation what you can do is you can do a colonoscopy. Ideally is colonoscopy. What is colonoscopy? You pass a small camera through your anus and inspect the whole of the large intestine. So these are the investigations. Along with it, there are other tests which has to be done. That is the blood test and CEA. CEA means it's a cancer marker, whether it is increased or decreased. So that has to be seen. And particularly for upper and middle rectum, you have to do an MRI abdomen. MRI is very important because all the treatment is based on MRI of that patient. So after doing this, if in colonoscopy or in proctoscopy they do and the biopsy prove that you have cancer rectum, then what you should do? That depends on what is the finding in MRI. If the growth is confined within the limits of the pelvis, it is not spread outside the bowel, then you can directly go for surgery. If some kind of spread is there in the lower abdomen, the cancer is spread, then they will give you radiation. So radiation can be short course for a week and long course. Always better is a long course. They will give radiation for 28 days, very safe. Patient does not have much problems. Very minimal radiation every day for 28 days. That is a long course radiation. After that, you have to wait for 1.5 months so that this tumor starts shrinking. So long course radiation. Then after that, you have to undergo surgery. So surgery is, you can do an open surgery or a laparoscopic surgery. Nowadays, open surgery is painful. You have to cut open the whole of the tummy. Instead, keyhole is a very good option. Keyhole is a painless surgery, and patient will be very comfortable. You take out the whole of the growth and remove it and bring down the normal intestine and attach it to the anus. And that is a surgery that is known as anterior resection, low anterior resection, or ultra low resection. These are the three terms which you use for the surgery. That depends on the level of the growth. And after surgery, you take out all the cancer and send it for biopsy, and the biopsy shows some spread. then you have to undergo chemotherapy, and generally chemotherapy is for 6 months. Very safe chemotherapy, you won't lose your hair and all, so sometimes it may be needed. So basically it may be radiation and surgery or chemotherapy. All these things are, the three aspects are involved, and nowadays the results are excellently well. And even you can do a robotic surgery also, but if you can do a keyhole, that would be much better. And robotic surgery doesn't offer much advantage over a keyhole surgery. It is a bit expensive. So these are the things which the treatment modalities of rectal cancer. What happens if you don't undergo treatment? The problem is the motion, it can't pass slowly. This rectum, it starts closing because of the growth, and you can't pass motion. Then sometimes you may need to place the bowel on the side of your tummy, and that may be permanent if you don't operate. So a colostomy is a big problem. It can spread to your liver, produce metastasis, can pass to your brain, which produces metastasis. In such situation, it is life-threatening. So always it is better to have an early diagnosis and treatment. Rectal cancers nowadays are very, very safe. So these are the three treatment modalities available for rectal cancer. Thanks for watching my video, and I suggest you to send the link to various different friends, and also continue watching my videos and subscribe my channel so that you'll get new videos. Thank you once again. Thanks.